to our seats. Mary, 16. We're at table 16. Okay, so why don't we start the program off? And we want to start off by saying good evening to all of you. And we want to thank you for joining us. And it's wonderful to see so many friendly faces again. We know that the weather is hard. We certainly recognize there's a lot of events to go to as we close the year. But this one, for us, and I'm sure for each and every one of you, is truly very special. And what a better place to have it in but the Waldorf Astoria. Isn't this magnificent? So, my name is Kevin Rigby, and I'm proud again to be the Master of Ceremonies for tonight for the 2024 Alliance for Aging Research, Heroes in Health, an evening where we're going to celebrate hope, resilience, and healthy aging. It means the world to us to have you here tonight to celebrate this. And on behalf of the Alliance, and the Alliance mission, I think, is really powerful, and it's one you need to hear. They're the leading nonprofit organization dedicated to changing the narrative to achieve healthy aging and equitable access to care. The Alliance vision strives for a culture that embraces healthy aging as a greater good and values science and investments to advance dignity, independence, and equity. It's an organization known for capturing the full potential of their vision by working together. And I think that's a key component of their success, by partnering with organizations, policymakers, and educators. So how does the Alliance do that partnering? The Alliance creates educational materials and leads advocacy efforts to provide equal opportunities for the treatment of every person of every age. So what's a true test? How do we know that they're achieving the metrics of this partnership? Well, let me tell you, the national, local, and health policy press look to the Alliance as a trusted resource, as well as a needed, provocative voice to push the envelope from where we are to where we should go. And since we've seen you last year, and many of you I know we've been back here, let me tell you some of the metrics that I'm so proud to share with you. 1, they've earned more than 100 press hits. 2, they've positively influenced Medicare affordability, access, and equity issues. And 3, they've empowered tens of millions of older patients and family caregivers with resources to help them make them informed, independent choices about their care. So that is why we're here this evening. So speaking of which, this is, I think, an important thing. We always think it's important to start off with a video. Please turn around, take a look at our reel here, which really goes to demonstrate the work being done over the past year by the Alliance. Please.
When I wake up in the morning, love, and the sunlight hurts my eyes, and something without warning, love, bears heavy on my mind. Then I look at you, and the world's alright with me. Just one look at you, and I know it's gonna be a lovely day. When the day that lies ahead of me impossible to fake. When someone else instead of me always seems to know the way, then I look at you and the world's all right with me. Just one look at you and I know it's gonna be a lovely day. When the day that lies ahead of me seemed impossible to face, and when someone else instead of me always seems to know the way, then I look at you and the world's all right with me. I just one look at you and I know it's gonna be a lovely day.
Great. Now, wasn't that impressive? Great. So with that, I'm now going to bring up our dynamic, inspirational leader, the president and CEO of the Alliance, Sue Peshin.
So 3 weeks ago, I was fired. Not from the Alliance. Waldorf Security is not about to drag me out. My mom fired me. Yeah, this sweet-looking lady. In November of 2020, my mom moved here from Pittsburgh after my stepdad was in a bad car accident from which he tragically did not survive. Since then, my mom has gone through quite a bit with her health. She's had 2 bouts of COVID-19, the first resulting in hospitalization before the vaccines arrived, and the second in post-acute care after a hypertensive crisis. We've had 1 home infusion experience related to an antibiotic-resistant infection, several trips to the ER, many, many doctor visits, and the equivalent of millions of frequent flyer miles with our awesome local pharmacists. In 2021, my mom started to show signs of memory loss, and in 2022, my mom's doctor told her she had dementia, likely Alzheimer's disease. Her personal care needs have become increasingly intense over time, primarily due to a neuropsychiatric symptom called apathy, which can be a hindrance in going to the bathroom independently. We went from going places on weekends to spending more time at events in her building and watching movies in her apartment. Throughout much of this, my mom referred to the two of us as, quote unquote, being in class together. She gave me permission to use our often frustrating experiences with the healthcare system and told me I really needed to work on fixing them. Family caregiving has completely changed the way I advocate. My mom and I lean on humor whenever we can. Growing old takes a heck of a lot of grit, and humor helps. Plus, the way people speak to and treat older adults in healthcare settings is often ridiculous when it's not downright insulting. This brings me to our first theme for tonight's celebration, which is hope. It's part of the human experience that our lives are forever saturated in the possibility of catastrophe. Bad things, accidents, illness, the loneliness of heartbreak and death happen to people every single day. We know this, yet we're tasked with finding ways of moving forward in a world where nothing is guaranteed. But how? Mainly, we find ways to oppose the dread of life's dangers with hope, an aspirational feeling that circumstances can improve, that we can persist, that there is at least as much good in the world as there is bad, and that maybe we can be a part of making that happen. The topic of hope is low-hanging fruit for pop culture and even politics. Not all that long ago, one US president hailed from a town called Hope, and another campaigned on it. But hope is also beginning to reveal its value in scientific studies. Among people with chronic illnesses, greater degrees of hope are associated with improved coping, well-being, and engagement in healthy behaviors. Among teens, hope is linked with health, quality of life, self-esteem, and a sense of purpose. It's an essential factor for developing both maturity and resilience, and it can help protect against depression. Fortunately, such benefits also extend into later life as the opportunities for calamities start to increase. Our bodies fail us. We may experience life setbacks like losing jobs, relationships, or family members. If our early challenges are so often related to growing and developing into healthy adults, later life can be thought of as a period of consolidation and acceptance of oneself, even as the physical body declines and circumstances shift for the worse. Despair is, on the other hand, lack of hope. It's a condition in which people are ambivalent about whether they live or die, often resulting in behaviors that jeopardize health and longevity. The rise in deaths of despair, premature deaths due to drug overdose, alcohol poisonings, and suicide have contributed meaningfully to the decline in our national average life expectancy since 2015. I would also argue firearms. Recent research by neurologists now finds clear linkages between the US crisis of despair and vulnerability to misinformation. Factors that underpin despair can make individuals more susceptible to extremism. They can make entire towns, counties, and regions more prone to radicalization and violence. Social exclusion, poor mental health, and abusive work environments contribute to these patterns. In contrast, people who have hope, which includes believing that they can invest in their futures, are much less likely to believe in misinformation. Living in communities with greater prospects and more information sources provides a reality check against false promises or outright lies. Much of what we do at the Alliance is about taking apart misinformation and disinformation in science and research, clinical care, and in health policy to stem its supply. Some of us thought the COVID-19 pandemic would be a wake-up call about how we care for older adults. Instead, we found that while many of us may love our own parents or grandparents, our fears of aging disconnected us from recognizing our broader common humanity. And it doesn't help that the Centers for Medicare and Medicaid Services, private payers, and even some policymakers seem to be shutting their eyes and holding their ears in refusal to reconcile increased resource needs for our rapidly aging society. This translates to the spread of misinformation in health policy to justify abusive utilization management practices. It happens with payer challenges to FDA's regulatory authority and biomedical expertise under the guise of evidence development. Sorry, Dr. Califf. Most significantly, it interferes in the practice of medicine and the ability of patients and families to make informed treatment decisions with the guidance of their trained healthcare professionals. It hurts underserved communities the most, and it often does so under a false banner of health equity. Last year, the world lost Judy Heumann, an internationally recognized disability rights activist, widely regarded as the mother of the disability rights movement. She was a leader in the historic Section 504 sit-in of 1977 and instrumental in the development and implementation of other disability rights legislation. Of the many insightful things she said in her years of activism, my favorite one is this: "But I was beginning to learn something very important. When institutions don't want to do something, to claim that something is a safety issue is an easy argument to fall back on. It sounds so benign and protective. How could caring about safety possibly be wrong or discriminatory?" We are blessed to partner in our health, education, and policy work on every issue we work on with many big deal groups we admire, who have members on the ground and all over the country. We are thrilled and fortunate to have many of them here tonight. Thank you for coming, and their logos are featured up on the screen. These groups are not only able to help stem the supply of misinformation, but they also help reduce its demand at the community level. To all of you, for the many times we reach out, sometimes at the last minute, thank you. And thank you for reaching back out to us to partner. We think you are a big, powerful dose of hope. Our second theme for the evening is resilience. Research on resilience has gained significant attention across various fields, including psychology, sociology, and neuroscience. Resilience is often defined as the ability to adapt to stress and adversity, bouncing back from challenges, and maintaining mental well-being despite difficult circumstances. The first major factor that contributes to resilience is having social support. Studies show that strong relationships with family and friends significantly bolster resilience. Personality traits, effective coping mechanisms, all these enhance resilience. Resilient individuals may even have different brain activity patterns when facing stress, particularly in areas related to emotional regulation and cognitive control. And this suggests a neurological basis for resilience. And resilience can develop at any age. Early life experience, including secure attachments and supportive environments, are crucial for building resilience in children. Different cultures approach resilience differently, emphasizing community, spirituality, and collective coping strategies. And this diversity highlights the role of cultural context in resilience development. The rub with resilience, though, is that we discover it only when we are forced to meet unavoidable suffering full in the face. It's when we face that reality and see ourselves and how we respond to it that we find the basis for resilience. Reality is almost always less scary than what we imagine, and it helps us with knowing what we're capable of, which is strengthening. And I want to go back to the first main factor that contributes to resilience, social support. On a personal level, I know I'm incredibly fortunate to still have my parents with me. My dad and my stepmom are here tonight, and they have both been role models in advocacy for me. My husband, Stephen, and my son, Max, are also here tonight. And you guys are my heart and soul, and I love you. All of us need help and support from people around us to become resilient in life. We need at least one person in our lives who interrupts the often negative narratives that run through everybody's brains. We also need people around us who challenge us and help us grow. Nothing that we do at the Alliance is done by one person alone, and our strength comes from depending on each other in pursuit of our common goals. These include our Alliance board members, our supporters, and our many advocacy partners. And on that note, I have an important list of thank yous, and I appreciate you joining me and acknowledging everyone. I do this every year. I hope you guys don't mind. But you guys are important to us. So first, I want to thank our host with the most, Kevin Rigby. You have a wonderful, uplifting energy, and we look forward to sharing the stage every year. Thank you to Michelle Marcus, who chairs our board of directors and connects with me and others on our team regularly to offer wise counsel. Our entire board of directors supports us in our mission in countless ways and serves as our guiding light. Please rise. If you're here from our board, I would love for you to be jointly acknowledged. Come on. Dorothy. Janet, where is everybody? Come on. Oh my gosh, you are so not a shy group. Okay. We are grateful and proud to partner with healthcare companies in pharma, bio, and device, and others in the public and private sector of healthcare and healthy aging. No one segment of the healthcare system can do the issues that we work on. We all need to work together. This evening would simply not be possible without the kind support of our sponsors, and please join me in applauding them at the end. Our award underwriters include the Claude Pepper Foundation, sponsor of our Claude Pepper Award for Advancing Healthy Aging, Eli Lilly and Company, sponsor of the Distinguished Public Service Award, Advamed, supporter of the Silver Innovator Award, GlaxoSmithKline, sponsor of the Daniel Perry Founders Award, and Otsuka, supporter of our Perennial Hero Award. Our silver sponsors include AbbVie, Biogen, BMS, Gilead, and the combined powerhouse that is the Davos Alzheimer's Collaborative, the Global Alzheimer's Platform, the Global CEO Initiative, and Us Against Alzheimer's. Our bronze level sponsors are Bio, Healthy Women, Johnson & Johnson, Lundbeck, Neurocrine, Novavax, Novo Nordisk, Penn-Quarter Partners, PWR, Prevent Blindness, and USP. And additionally, we thank our fabulous conversation sponsors, Eisai, Merck, and Otsuka. Our conversation supporters, Applied Policy, Ardelex, Bright Focus Foundation, CHIPA, Kenvue, Omnicom Group, and Pharma. And our conversation innovators, Acadia, Alzion, Amgen, Genoscopy, HMA, King & Spalding, Mikulski Health Force, National Pharmaceutical Council, PCMA, Pfizer, Reservoir Communications Group, Venable, and Women Heart. Let's give all of our sponsors a round of applause. And last, I am so proud of the individuals I get to work with who tackle the issues and keep us running smoothly every single day. They are all super smart, motivated, and kind, a true team of people that are essential to each other's success and to mine. Many of you know that Sarah has been on maternity leave since early August. She is our development person. She did the equivalent of nesting with us beforehand, setting us up and ahead of the game with sponsorships, video explainers, and calendar assignments. Still, there was a ton to do that in hindsight has given us an entirely new level of respect and admiration for the magic that she creates for us each year. Then her deputy resigned. And we still had my niece, Gabby, who is a senior studying event planning at the University of Maryland and was serving as a part-time intern for us. And she called me and said, "Aunt Sue, am I in charge of the dinner now?" I put it out there to our team in my usual way that it would all work out. Luckily, Lindsay Clark, who many of you know, operates on planet Earth. And in mid-August, Lindsay started watching Sarah's videos and very quickly taught herself our event systems and processes. She took over Heroes in Health like a total and complete boss. I am thankful for her steady leadership and for the privilege to work with her and know her. Michael Ward, you made your mark and did good here. Thank you. We will miss you. But we don't plan to lose touch. We will Michael our calendars for coffee and lunch and look forward to watching you soar even further. I would like Lindsay, Michael, and our entire awesome team to please stand and for you to please join me in acknowledging them. Okay, so, and I'm almost done here. Our final theme for the evening for us is always healthy aging, which leads me back to two items: why I got canned by my mom and hump day updates. First, mom. Luckily, she didn't fire me as her daughter. However, she was uncomfortable with me doing her personal care, which became a more frequent part of our time together on weekends. I was also really burnt out, and she knew it, even with Alzheimer's. I learned this when I finally called uncle on myself, and I asked our wonderful weekday caregiver if she and her niece could help me more on weekends. Simi, my mom's caregiver, told me that my mom had been talking with her about this for quite some time, plus my mom told her I did not do a good job on her makeup. So the aging advocate in me had no idea I had been crossing a line. My mom wants to be my mom, not my patient. I'm still in charge of medications, doctor's visits, and a lot of other stuff, minus makeup. But if I had to name one big thing I learned this year about healthy aging, it's to make sure loved ones retain a sense of dignity and agency over their care. Last are Hump Day updates. What began as an experiment has grown into a weekly labor of love, offering connection to many of our favorite people and a cheeky outlet for the absurdities of DC health advocacy and communication. Thank you to Katie Riley for being the force behind it, for hanging out with me each week, and for pulling me back when I may go a little too far. If you're not signed up but you want to be, shoot me an email. I'm supposed to tell you before I go, if you take pictures, they don't count without tagging us and using the hashtag Heroes in Health. We will like them and keep the party going. On behalf of the Alliance for Aging Research, thank you all for being here. We are honored to have you join us, and I hope you enjoy the rest of tonight's program. Thank you so much.
That was great, Sue. First of all, you may have been fired by your mother, but you have lifetime employment at the Alliance. What do you think? Secondly, a note to all of you, pictures are being taken. I don't know, but this salad is both delicious and sits right there. So I'm just telling you, we want to have good pictures of you. So talk to the ones right next to you. You'll get some nice words, all right? Because we're going around with pictures. But anyhow, as you saw from Sue going through this, the partnerships that exist in this room is what gives us the power. Together, we are making a huge difference, and the journey is still ahead of us. This is no longer a possibility, but a reality. And really, the Alliance is the glue, the inspiration, and Sue, all those things we've heard from you, we want to thank you and keep the momentum going. So with that, we have our first award presenter tonight, is Shannon Stehauer. So Shannon is Vice President of Federal Government Affairs for Eli Lilly and Company. In her role, she works with lawmakers to advance policies that support biopharmaceutical innovation. Prior to Lilly, she worked for Pharmaceutical Research and Manufacturers, better known as PhRMA, the trade association that represents the leading biopharmaceutical research companies in the United States. She also spent several years on Capitol Hill working for Senator John Hoeven and Congressman Mike Rogers. We particularly want to thank Lilly and Company for their generously underwriting the Distinguished Public Service Award. Let's give a big round of applause for Shannon and bring her up here.
Good evening, and thank you, Kevin. On behalf of Eli Lilly, I'm honored to introduce Representative Kathy McMorris Rogers, this year's recipient of the Distinguished Public Service Award. This award is presented annually to a Republican member of Congress who exemplifies leadership in promoting policies that advance medical research, innovation, and care for Americans as they age. Tonight, we celebrate Representative McMorris Rogers not only for her remarkable career, but also her unwavering commitment to improving the lives of all Americans and people of all ages with disabilities. Her leadership is personified in her role as chair and previously the ranking member of the House Energy and Commerce Committee. The Congresswoman established an extraordinary legacy as the first woman from either party to lead this distinguished committee. During her years of exceptional public service, Congressman McMorris Rogers has been instrumental in advocating for the 21st century cures, supporting the FDA, and ensuring that much-needed medical innovations continue to move forward without payer access barriers. The Alliance is especially grateful for Congresswoman McMorris Rogers' bipartisan efforts to protect beneficiaries with Alzheimer's disease by enhancing Medicare coverage for approved therapies and ensuring that beneficiaries have the diagnostic tools needed for that care, such as amyloid beta PET scans. This work is incredibly meaningful for the patients and families whose lives are impacted by this condition, giving us hope for a future where access to needed care is not determined by our financial circumstances. Because of her son Cole, who was born with Down syndrome, Congresswoman McMorris Rodgers spent most of her time in Congress as an ability advocate to ensure that everyone has access to compassionate, quality care. Her leadership on advancing a better life experience, or ABLE Act in 2014, created tax-free savings accounts for people with disabilities to pay for qualified expenses. Harnessing the momentum of the bipartisan effort to enact the ABLE Act in 2014, to date, almost all 50 states have enacted their own versions of ABLE, and many are in the process of establishing state ABLE programs. The Alliance also praises her sponsorship and championing of the Protecting Healthcare for All Patients Act, which would extend the current ban on the use of quality-adjusted life years, or QALYs, and similar discriminatory measures in the Medicare program to all federally funded healthcare programs. In her inspiring floor remarks last February, the Congresswoman stated that Medicaid is the largest payer for people with disabilities, and we are letting it use measures that discriminate against the very people it was designed to support. And that is to say that millions of injured, disabled veterans who rely on the VA for their health care, which is also allowed to use these types of measures. I hope that by banning the use of discriminatory measures from federal payers against people with disabilities and chronic illnesses, and affirming that every person's life has value, is something that we can all agree on, and we couldn't agree more. Though she will step away from Congress at the end of her current term, her dedication to promoting patient-centric reforms has made a lasting impact on the healthcare landscape. As we honor her with this award, we extend our gratitude for her years of service and advocacy and work, and look forward to seeing what she does next. Representative McMorris Rodgers, your leadership has been an inspiration, and your work will greatly benefit generations to come. Please join me on the stage to accept the Distinguished Public Service Award.
Thank you, everyone. Thank you, Shannon, for the kind introduction. Thank you, Sue, for your extraordinary leadership. And Senator Hirono, it's great to be here with you tonight. I'm greatly honored. And to all the advocates, to the providers, to the innovators, the manufacturers, thanks for all you do to continue this quest to improve our healthcare outcomes. We really are it's an exciting time, an unmatched time as far as the potential for breakthroughs, and it doesn't seem to matter which disease group I meet with, they are so excited about what's going to be possible. So it's just a great honor to be with you tonight. Thank you for what you're doing, and let's make sure that we continue to seize this moment. I want to especially thank you for your support, the Alliance for Aging Research, both for the award and for your support of the quality legislation. This has been a priority for me this Congress as the chair of the Energy and Commerce Committee. In my office, we refer to it as the quality ban bill, but this is the Protecting Healthcare for All Patients Act. And at every step of the way, you have been there helping advocate, help educate the members, the staff on this important legislation. Shannon mentioned that our oldest was born with that extra 21st chromosome that you all know as Down syndrome. That was 17 years ago, and he really did change my life. And to see the world through his eyes has made me both a better mom and a better legislator. And I'm reminded every day as I watch him as to the potential of every life. And I'll always remember when we first got that diagnosis and the team I met with Brian and myself, and they gave us this long list of everything that might go wrong. And if any parent got that list upon the arrival of your baby, it would be overwhelming. But Cole has completely exceeded all the expectations that we had. I've learned not to put any limits on him. And today he's a junior in high school. He dreams of being a football player, a race car driver. He wants to be a pastor as well as start a band. He's taking drum lessons. Although he told me just yesterday, I'm taking my guitar. We're gonna switch now. I'm gonna learn guitar. I mean, the sky's the limit. And he has greatly influenced me in my work, and I'm just so grateful for Cole. Certainly, on Capitol Hill, we want to ensure that everyone has the opportunity to reach their full potential, and that we want to make sure that we have a system, a healthcare system that doesn't treat individuals with disabilities or chronic health conditions differently, and that is why the Qualities Bill has been so important. I also wanted to highlight, Shannon mentioned that I'm the chair of the House Energy and Commerce Committee, which has just been extraordinary to finish up my time in Congress as the chair. We have worked on a number of pieces, bipartisan legislation. Very proud that we've been able to get many of these on the president's desk. The Qualities Bill is still in the Senate, so continue to call the senators and make sure that they are making it a priority for the end-of-year package. You can help me with that. I think everyone in this room can vouch for the reality that qualities shouldn't be used to discriminate against people, and yet some will say, well, they're not necessary. They're still used in Medicaid, as was mentioned, and shockingly at the VA. Our committee has also been working on a number of other issues important to supporting the health and well-being of seniors. We just passed this last week legislation that I've championed for Include at NIH, which is to ensure funding and support for individuals with Down syndrome. When Cole was born, it was the least funded condition at NIH, and we've made some great progress, but funding research for those with Down syndrome isn't just about those with Down syndrome. What we've learned is that if we can look at what's going on in that 21st chromosome, these are individuals that are living longer today. They're developing dementia and Alzheimer's, almost 100%. They have juvenile diabetes at a higher level. They're developing some cancers, even though they don't get the tumor cancer. So let's look at what's going on with these individuals with Down syndrome. And already the Include project has made a big difference for many people. We also just passed out of the House the legislation to extend and strengthen the national plan to address Alzheimer's disease. Long-time effort that's led by my friend Congressman Chris Smith. And we've worked on other legislation this Congress to extend access to telehealth services for seniors, improve access to prescription drugs by removing certain hurdles for seniors, implement site-neutral policies to ensure seniors aren't charged a higher amount just because their doctor's office might be bought by a hospital system. Finally, it was mentioned that I have decided not to run for re-election this year. So at the end of 20 years, I do find myself reflecting a bit, and I just wanted to share with you that being a member of Congress, it is an amazing institution, and this great experiment in self-governance it really is worth fighting for. So I just want you to know that as I leave. Lots of people focus on the division. There's a lot that unites us, and we've been able to work together on the Energy and Commerce Committee. I also wanted to celebrate, again, the 10-year anniversary of the ABLE Act, and we've now built upon ABLE with ABLE to Work, ABLE Financial Planning, ABLE Age Adjustment, and we're putting the finishing touches on ABLE 3.0, which is opening up more opportunities for individuals with disabilities to live independently, to work, get an education, transportation, all that to say the best is yet to come. So keep up the great work. Thank you again for this honor.
Okay, congratulations again, Representative Rogers. You leave a rich legacy. So our next award presenter this evening is certainly a great friend to the Alliance, Tom Spulek. Many of you know him, and certainly when you hear his resume, you certainly understand why he's impressive, why we're proud to call him our friend, and this incredible program and event that he runs with regard to as chairman and president of the Claude Pepper Foundation. He's here to present that award, the Claude Pepper Award for Advancing Healthy Aging. Tom will tell us more about this important award, named after the Honorable Claude Pepper, who fought tirelessly in both the U.S. Senate and in the House of Representatives to help those in need, including our nation's older adults. In his day job, Tom is partner in the law firm of King & Spalding, and he chairs their government advocacy and public policy group right here in Washington, D.C. Tom also serves as an adjunct professor at the Florida State University College of Law. Prior to entering private practice, Tom served as staff director and general counsel of the House Committee of Rules, as well as general counsel for the U.S. House of Representatives. And to no surprise, and to those who know Tom, he devotes an awful lot of time to nonprofit work in his, quote, spare time. Tom and Claude Pepper Foundation have been incredible friends to the Alliance. We thank the Foundation for once again supporting this year's Claude Pepper's Award for Advancing Healthy Aging. Please join me in giving him a big round of applause for Tom.
Thank you, Kevin. You're a great friend. Good evening. It's an honor to present this year's Claude Pepper Award for Advancing Healthy Aging to a true champion for America's older adults, Senator Mazie Hirono. Before I begin, I want to thank Sue and her great team for the remarkable work they do at the Alliance and for giving the Pepper Foundation the opportunity each year to present the Claude Pepper Award to a deserving Democratic member of Congress. If I can say one personal thing, I've watched the Alliance grow. Dan and I worked on the Hill together, he in the Senate and I in the House. And I watched Dan create and move the Alliance along. And if anybody ever doubted that anyone could replace Dan and, in fact, exceed him, all you have to do is look at Sue, and you would know that she can. So before highlighting Senator Hirono's incredible work, I'd like to reflect on the legacy of Claude Pepper just for a moment. As Kevin said, he served in the Senate from 1936 to 1950, and then, in a somewhat rare move, moved over to the House and served there from 1963 to 89 as chairman of the House Rules Committee. Most people think of him today as the spokesman of the elderly, having served as chairman of the House Aging Committee in the 1970s. And they wouldn't be wrong. He sought to strengthen programs for older adults and disabled Americans, including Social Security, Medicare, and Medicaid. Many don't know, however, that while he was in the Senate in the 30s and 40s, he sponsored bills for national health care, equal pay for equal work for women, cancer and heart disease research programs, and a minimum wage. And very relevant to the Alliance, I might say, Senator Pepper was co-author of legislation that established the National Cancer Institute and 5 of the original Institutes of Health. Suffice it to say, he dedicated his work to advocating for elderly as well as all Americans. Next year will be the 125th anniversary of his birth, and we'll be hosting a series of events at the Claude Pepper Library at Florida State in his honor. And we also just finished producing a 30-minute biography of him, which I would encourage anyone who wants to know more about Claude Pepper to watch. It's available on the Foundation website, claudepepperfoundation.com. But now to tonight's recipient. The Claude Pepper Award for Advancing Healthy Aging is given each year to a member of Congress who demonstrates exceptional leadership in advancing policies in medical research, innovation, and care to benefit Americans as they grow older. Since her time in the House of Representatives and throughout her tenure in the Senate, Senator Hirono has been a tireless advocate for expanding health care access and protecting vital programs like Medicare and Social Security. Her leadership has improved the lives of millions, ensuring that older Americans receive the care and support they need. Senator Hirono recognizes that quality of life as we age is not just about health care. It's about ensuring and preserving dignity, independence, and financial security. Though Senator Hirono has many achievements in her legislative career, tonight we want to note the story of her championing the Protecting Seniors Through Immunization Act, which was passed into law in 2022 as part of the Inflation Reduction Act. This crucial legislation removed barriers to vaccination by eliminating beneficiary coinsurance for vaccines recommended for Medicare beneficiaries. However, passing Protecting Seniors wasn't a short-term goal for the senator. In fact, she first introduced the legislation in her first term as a U.S. representative some 15 years before it was passed into law, and continued to introduce that legislation in each session, advocating and building a coalition to get it done. That perseverance and commitment to getting the job done, no matter how long it takes, is core to the senator's work. Sitting on the sidelines is simply not in her DNA. During the COVID-19 pandemic, Senator Hirono was a leading voice in combating disinformation and expanding access to reliable information for vulnerable groups, including older adults, individuals with disabilities, and those who are deaf or hard of hearing. Her commitment to transparency and public health has been a lifeline for many during these uncertain times. In addition to her work on healthcare access, the senator has been a steadfast advocate for health equity. Her leadership on the Health Equity and Accountability Act has advanced policies that address healthcare disparities, particularly for aging populations and minority and underserved communities. So in the spirit of Claude Pepper, Senator Hirono leads with compassion, courage, and unwavering dedication to the well-being of older Americans. Her efforts reflect the work of Claude Pepper and the Alliance to advance sound policies that improve care and enhance the quality of life for older adults. Senator Hirono, your leadership has truly made a difference, and it is my privilege to present to you this year the Claude Pepper Award for Advancing Healthy Aging. We look forward to your continued efforts to ensure that all Americans can age with dignity, health, and hope for the future. Congratulations.
I'm so glad that this podium is, you can see through it, because otherwise you're only going to see the top of my head, which is not a really fantastic look for a U.S. Senator. Thank you so much, Tom, for that lovely introduction. And as we say in Hawaii, aloha. Okay, some of you have been to Hawaii. It's a pleasure and an honor for me to be here. And as I sat listening to Sue, it's very clear that the Alliance will not be able to get along without you. You covered a lot of all of the programs and the wonderful issues and all of the issues that you address in the Alliance. And as I sat listening to Tom talk about some of my background, I thought, well, I'm trying to age with dignity myself, you guys. So I'm I'm on your page. And for many of us, we have had experience with aging, because in my own family, my grandmother lived with us, and my mother lived with us until she was 96. And so the progression of their aging process and all that involved, and the strokes that my mother had, and the need for caregiving, all of that, these are family experiences that many of us have had. So of course, I am very much honored by the Alliance giving me this recognition. And of course, I know that I'm standing between you and dinner, so I'm told that I should keep this short. Especially as I'm told that this is not a chicken dinner night, that you are having steak and lobster, is that right? Yeah, well, that's okay. So so I don't want to take too much of your time. So clearly, Claude Claude Pepper is someone that we can all emulate, and the years of public service and what he exemplified in his advocacy is very much alive and well in your organization. And of course, I, like you, am grateful for his lifetime of service. I don't know if Kathy's still here. Thank you so much for your 20 years of advocacy in the U.S. House. I served with her for 6 years when I was there. But standing before you, I'm glad to join the ranks of leaders like Frank Pallone, with whom I also serve, Chris Van Hollen, and my neighbor, Anna Eshoo. I think you honored her last year. She lives right above me in the same building. So, you know, this is the first time that I have really, frankly, heard very much about the Alliance, but to know that this is an organization that covers so many of the issues that relate to the challenges that our seniors have. And Hawaii has one of the fastest growing aging population with all of the attendant issues. Your organization and the research and everything else that you do, the programmatic support that you provide for seniors to be able to age in place, is really critical to Hawaii and basically throughout our country. And as I said, my grandmother lived with us until she was 99, and my mother until she was 96. One of the things that I cared a lot about was the ability of seniors to get preventive care, especially in the area of vaccines. So yes, I introduced a bill in 2012 or something, whatever it was, way back when, on vaccinations, and particularly the shingles vaccine, because I had had shingles not just once, but twice. So I know what it was like to experience shingles, and I thought that this is a vaccine that seniors should be able to afford, but many didn't because out-of-pocket costs were $200, $300, and so it is a bill that I introduced quite a while ago, and I am nothing if not persevering. That's what it takes sometimes to get things done in the House and the Senate. So I won't take too much more of your time. Just know that I am very grateful for your advocacy, clearly enabling our seniors to age with dignity, to age in place. All of the pharmaceutical companies who are here, who are providing the kind of research on Alzheimer's and cancer, all of the kinds of ailments that particularly strike hard on an aging population, I thank you very much. As I was able to talk with some of you from the pharmaceutical industry, I said, I am a person who really, I do understand, while we have all these debates about the high cost of pharmaceuticals in our country, I also understand the important work that you do in cutting-edge research that will enable all of us to live healthy lives. Mahalo nui loa to all of you, and thank you so much for this honor. Aloha.
Well, thank you, Senator Hirono, for all your work that you are doing and continue to do. So what time is it now? It is dinner time, which is great. As you heard what we have for the menu, so it's going to be a fantastic dinner. We want you to sit back, enjoy the dinner. There's also going to be a photographer going around, so please make sure you get the picture with the table so we can have it for next year. So enjoy your dinner, and we'll be back shortly. Thank you. Okay, well, why don't we start up again? And this way we can keep the program moving. Our commitment is to hopefully get you out of here by 9 o'clock. So, shh. So I hope you enjoyed the dinner. It was wonderful and delicious, but the program still continues. Our next award presenter tonight is Bobby Patrick VI, who serves as Senior Vice President of Government Affairs at AdvaMed, the MedTech Association. He oversees AdvaMed's state affairs work and partnerships with external stakeholders, including patient advocacy organizations and physician groups. Previously, Bobby served as Vice President of Strategic Growth and Policy at Medical Ally Association, where he led the state and federal advocacy efforts. He also oversaw the membership work at the association, where they experienced growth in membership, revenue, engagement, retention, all under his great leadership. The Alliance is grateful to AdvaMed for its general support for the Silver Innovatives Award. Please join me in welcoming Bobby as he honors the groundbreaking work of Dr. Jeffrey Cummings, our 2024 Silver Innovator Award nominee. Here she comes.
Good evening, and thank you, Kevin. The Silver Innovator Award recognizes an outstanding individual who has furthered research and innovation in healthy aging. Dr. Jeffrey Cummings is known globally for his inspiring leadership in Alzheimer's disease research and clinical trials. He has been the principal investigator on multiple clinical trials and authored more than 40 books and 850 peer-reviewed research articles. He currently leads the Chambers-Grundy Center for Transformative Neuroscience at the University of Nevada, Las Vegas. However, that is his latest stop in an impressive career of directorships at centers devoted to Alzheimer's disease research, including the Cleveland Clinic and UCLA. His leadership of the Alzheimer's disease drug development pipeline, known as the ALZ Pipeline, led to annual publications of clinical trials in AD-related therapeutics, improving awareness of ongoing Alzheimer's disease clinical trials for patients and families. Dr. Cummings' development of the Neuropsychiatric Inventory, or NPI, assessment tool nearly 30 years ago has been used in more than 350 clinical trials in over 40 languages. It is only one example of his compassionate approach to clinical care, always seeking to put patients first. His long association with many patient advocacy groups, including the Alliance's Accelerate Cures and Treatments for All Dementias, or ACT-AD initiative, and Project Pause, also illustrates his generosity in lending his deep scientific expertise in Alzheimer's research to inform policy development and contribute to educational resources for patients and family care partners. His ability to make complex findings about the status of Alzheimer's-related research discoveries relevant to patients, families, and caregivers is renowned. We also want to recognize that Dr. Cummings is joined tonight by his brilliant wife, Dr. Kate Zhang, a key leader in Alzheimer's treatment and research, who serves as Director of Innovation at Chambers-Grundy Center for Transformative Neuroscience at the University of Nevada, Las Vegas. We are inspired by your deep affection for one another and for how you continue to push the field forward for research, diagnostics, and treatment for Alzheimer's disease and related dementias. There has never been such a promising time for people living with the disease, and that is due in no small part to your work. Dr. Cummings, if you would please join me on the stage to accept this award.
Thank you, Bobby. Really, really great to be here. Thank you. And thanks for acknowledging Kate for all of her work with me as well. That we've had a wonderful partnership through most of this. We're at an incredible time in Alzheimer's disease research. This is an historical moment for all of us who have been here hoping for a breakthrough and now seeing a breakthrough. There was a 20-year hiatus in which there were no new approvals for Alzheimer's disease therapeutics, 20 years. And then since 2021, we've had 3 new drugs approved. We have leaders from Eisai and from Lilly here with us tonight, and these are the companies that have been leading that effort. These drugs are different from any other kind of drug we've ever seen. They break the bones of Alzheimer's disease. They don't stop the disease, but they slow it substantially. They give our patients and their families additional years together. That's what we want. That's the dignified part of aging that we're trying to achieve. I want to acknowledge the FDA. The next awardee is Peter Marks, and Peter has been an important part of the dialogue about accelerated approval and how we can get drugs to patients faster. That's ultimately what we want. Now, these drugs are given intravenously, and they have side effects, and they require a lot of management. But they are an incredible first step. When a first step takes you 30% of the way, you know that you've taken a step that can lead to walking and running, and that's the process that we are in. I couldn't be more excited about it. Now, there's another breakthrough, and the Alliance has been particularly important in this regard, Sue. And that is the approval of a drug for agitation in Alzheimer's disease. This is the first drug approved for any neuropsychiatric disorder in Alzheimer's disease. And it's 2024, and this is the first drug for that. It's incredible. So it's for agitation, and agitation is one of the most destructive behaviors for patients and for families, and erodes quality of life in an incredible way. So these breakthroughs are very important, and the Alliance has been instrumental in terms of their pause program that has particularly championed the ability of doctors to use these drugs when necessary. That's what we wanted. Another type of progress that I want to call attention to is biomarkers. Wouldn't it be great if we had a blood test for Alzheimer's disease? So you could go to your doctor when you're 50 or 55 and start getting a blood test every few years and know what your risk for Alzheimer's disease is. And we are that close to being able to have that test. There's no question about it. We are going to have that test. So this is just another part of the excitement that drives me and makes me happy to go to work every day. I will mention that in the audience we have John Dwyer. John is the head of the Global Alzheimer Platform, and it's one of the instrumental enterprises for advancing biomarkers. But I want to say that all this progress is not enough. Our science advances do not reach enough people. There are minority populations, racial, ethnic, gender, rural, that have had no opportunity to participate in research or to take advantage of these advances, and we need to change that. It's unacceptable. So NIH, FDA, universities like ours, advocacy organizations, and many others are working to change this, and I wanted to thank Karen Jones, who will be getting the Perennial Hero Award soon for her work in terms of the leadership of the Black Caucus and Center. There's much more to be done. You know, one of the exciting things is that the lessons of Alzheimer's disease are lessons that can be extended to Lou Gehrig's disease, to Parkinson's disease, to almost every neurodegenerative disorder of late life. And that means that progress in one will open the door to progress in others. That requires funding, and I want to thank Senator Hirono and Congresswoman McMorris Rogers for the tremendous support that they have given of NIH funding for Alzheimer's disease research. We have to have that money in order to advance it, and that research and investment in universities is what leads to the science that brings us new therapies. We need support for pharmaceutical companies and pharmaceutical innovation, and we need support for medical technology and medical technology innovation. These are the things that makes patients' lives better. We need the continuing support, of course, of advocacy groups like the Alzheimer's Association and powerful political groups like the Alliance. So, Alliance and Susan, I thank you for all you do. I look forward to many battles. You know, I have a battle mentality when I come to the Alliance, that we're going to fight and we're going to win for our patients. That's what gives me hope. So I'll finish by saying that we are fighting for the world's most important natural resource. That is the human brain, and we cannot fail. Thank you.
Thank you so much, Dr. Cummings, and we join you in the battle as well together. We want to thank you, and certainly your wife joining you here this evening. It's now my pleasure to welcome Jessica Riviera. Jessica joined GSK as the head of patient advocacy and engagement in April 2024. She was previously with Ultragenyx, where she led the global patient advocacy team. Jessica has worked in the biopharmaceutical industry for over 20 years. Before GSK, she worked at the patient advocacy for Ultragenyx, Biogen, AbbVie, Novo Nordisk, and Bristol Myers Squibb. During her tenure at Biogen, she launched the first ever treatment for spinal muscular atrophy. And prior to joining the industry, Jessica worked in the U.S. Senate and the Centers for Medicare and Medicaid Services. GSK is kindly supporting this year's Daniel Perry's Founders Award. Let's give her a big round of applause for Jessica.
Very short here. Good evening. I'm delighted to be here with all of you tonight to present the Daniel Perry Award. This award is named for the Alliance founder who founded the Alliance in 1986 and has championed the advances in medical sciences to help people live longer, healthier, and more productive lives. There are few individuals that reflect the practical actions that embody this mission more than this year's recipient, Dr. Peter Marks, Director of the Center for Biologics Evaluation and Research, and known to all of us as CBER at the FDA. Dr. Marks has led CBER since 2016, after previously serving as the Deputy Director and before that the Chief Clinical Officer of the Smilow Cancer Hospital. While he is a brilliant research scientist and an organizational leader, what sets Dr. Marks apart is his patient-centered approach. As a senior leader at the FDA, his job description entails overseeing approvals of biologics and vaccines. However, his interactions with the patient and advocacy community, his background as a clinician shines through. Dr. Marks regularly makes time to engage with patients to clearly communicate about science and the importance of staying up to date on regular health care, including vaccinations. He also understands that bringing new medicines to patients does not end with FDA approval. In the vaccine space, he provides input to the CDC as they consider recommendations, because we all know approval without meaningful access is kind of irrelevant. Dr. Marks's ability to clearly communicate often complex scientific and regulatory concepts was never more needed than during the COVID pandemic, when CBER was tasked with the Herculean task of evaluating the safety and efficacy of vaccines with unprecedented timelines. As Dr. Marks told the Washington Post in August 2020, "When I hear in my head is out of a James Bond movie." I'm kind of wondering which character is his favorite. Which actor is his favorite, Johns? When M says, "This is the big one, 007, do not mess it up." Dr. Marks and his team more than accomplished the mission, helping to bring safe, effective COVID vaccines to the American people in less than a year. Joining me tonight, thank you. Joining me for this very special presentation is the FDA Commissioner, Dr. Robert Califf. Dr. Califf was confirmed as the Commissioner in 2022 for the Food and Drug Administration's 25th Commissioner. But this is not his first time at the FDA. He previously served as the Commissioner in 2016. Before that, he was the FDA Deputy Commissioner for Medical Products and Tobacco. Dr. Califf has a distinguished career as a public servant, physician, researcher, and a leader in the fields of science and medicine. He is a nationally recognized expert in cardiovascular health, medicine, healthcare quality, translational research, and so much more. Some highlights in his resume including serving as the head of medical strategy and senior advisor at Alphabet, and as a professor of medicine and vice chancellor of clinical and translational research at Duke University. Dr. Califf, you're on stage already. Here you go. Welcome.
Thanks so much. And this, of course, is about Peter Marks and not about me. So I'll make 4 quick points about Peter. Number one, I'm really proud to have appointed him in 2016 to be head of CBER, and I think history has shown that I actually did make at least one good appointment during my time as commissioner. Second, Peter and I are members of a rarefied club, the Early Morning Club. I spent my career in intensive care units, and so I would get up at 5 every morning as a cardiologist so I could pre-round on patients. And if you want to talk to somebody at 6 or 6:15 a.m., Peter Marks is at your service. I don't know exactly why he's an early morning person too, but we have our best conversations before most people are really up and at 'em. Third, and I think most importantly related to this award, I had a thing about intensive care units that when students and interns and residents and fellows would rotate through, the soul is sort of laid bare when you're taking care of critically ill patients in the middle of the night. Life and death is occurring around you, very difficult circumstances. You learn a lot about people in that circumstance. I think the pandemic was Peter's intensive care unit experience. And what was revealed under the stress and strain as he led that team in warp speed and all the things that happened after that is a remarkable resilience, a dedication to truth, the ability to have the courage to say no when things are not going to work. I've heard a lot of talk here about getting treatments to patients faster. We should do that, but we should also get treatments to patients that work. And most things that people try actually don't work. It takes a lot of courage for somebody like Peter to say no. At the same time, he gets the adulation when he says yes, and it works out. So he showed an amazing amount of courage and resilience. And then finally, my little plug for Peter before he gets up and talks. COVID was a harrowing experience. I saw the first part of it from the outside as I worked at Alphabet, and then I joined the team in midstream. We're not really done with COVID at this point, but it is now one of many issues that are being dealt with. What an amazing time it's going to be for Peter. You think about the future of vaccines, the ability now to edit the genome of human beings and what that's going to involve, and cell and tissue therapy with the way that's advancing. Another way of saying this is Peter's hiring. So if any of you out there want to really have an exciting time and work for Dr. Marks, this is your time to do it. It's going to be an amazing time for he and his organization. Thank you.
So Frank Lloyd Wright said that the longer I live, the more beautiful life becomes. And this is truly a beautiful award to receive. And I'm incredibly grateful to the Alliance for Aging Research for selecting me to receive it, as well as to Jessica and Dr. Kayla for their really kind words. The work that took place at an incredibly rapid pace, developing safe and highly effective COVID-19 vaccines, saved hundreds of thousands of lives in the approximately 2/3 of the older U.S. population that embraced them. However, as a public health professional, it's really sobering for me to think about the unnecessary loss of life in the third or so of individuals in that age range who did not. And it's my hope that going forward, with the help of partners like the Alliance for Aging Research, we'll save more lives by finding the means to effectively deliver the necessary information to allow people to make informed choices about vaccines and other treatments based on true and accurate facts regarding their risks and benefits. The benefits of vaccines over the course of time have proven quite measurable and are indeed such a wonderful public health achievement that we really should embrace and cherish them. So I hope that's something that we can all come together to do in the coming years. And with that, I'm going to get a couple of extra chits back now because I'm going to stop and say thank you so much, and I wish you the best of the rest of the evenings. Thank you for this award.
Right, she was coming up, right. I got the finger to come up. I was like, I'm going to keep going this way.
Getting a high five from Kevin might be the highlight of my evening. Good evening, everyone. I hope you're enjoying yourselves. My name is Michelle Marcus. I'm the chair of the Alliance of Aging Research's Board of Directors. On behalf of the board, it is my pleasure to be here with you this evening to celebrate as you're seeing the tenacity, the vision, the sheer courage of this year's award recipients are inspirations in every facet of our work. We are honored to consider them partners in helping people live longer, happier, more productive lives. Please join me in congratulating them again for all they do and for all the hope, as Sue said, that they bring us. I also want to thank my colleagues on the Alliance's Board of Directors who stood up before. I won't make them do that again. Each board member has made a significant contribution to helping the Alliance with its mission, and they are equally invested in making sure older Americans receive access to the care and treatments necessary to live long-lasting, healthy, and rewarding lives. The generous corporate organization and individual contributions received at our annual Heroes in Health celebrations allow the incredible Sue and her wonderful team to be out in front of so many important topics. Just to name an important few: Medicare affordability and access issues, bring awareness to heart valve disease and neuropsychiatric symptoms of dementia, advocate for older adults to receive their CDC-recommended vaccines and COVID boosters, help older adults become engaged in research and advocacy through the Talk Nerdy program, a personal favorite, and activate the many initiatives that the Alliance works on throughout the year. And your being with us tonight inspires us to keep moving forward every day to ensure that the experience of healthy aging in this country is one of progress, dignity, and kindness. So thank you. We hope our work inspires you to connect with us at an individual level of support. So this is that moment in the night, guys, where I look at all of you and say, thank you, and please, all your contributions received tonight are fully tax deductible and will further the Alliance's mission. Please Consider making a personal contribution this evening by turning to the iPads on your table and clicking the Donate Now button at the bottom of your screen. You'll even find there's a QR code. Who doesn't love a QR code? You'll see one right on the screen behind me, right there. If QR codes maybe not your thing, you haven't gotten back on that wagon yet, don't worry, we've got you covered. First, open up your camera on your phone. You can point your camera to the QR code. I feel like I'm teaching everyone how to do this. If you are an Android user and don't know how to do it, well, don't worry, you'll see a banner pop right up. If you're an iPhone user, you should see that little yellow URL link. Who doesn't know what that is, right? You can tap the banner, you can tap the link, you can do either, and you can make a secure donation on the Alliance's page. If you need any help, feel free to ask someone who is an Luddite like me, or anyone at the Alliance staff who are seated at table 32 back there. Let's please applaud them again for all the work that they do. And they will be happy to help you. Thank you again for all of your great contributions this evening. Thank you to the honorees and congratulations, and to Sue and the entire Alliance team for such an extraordinary event. Now I will hand it back over to Kevin. We can do another high five, Kevin, if you like, who will introduce our final award. Thank you all.
Great teamwork. Michelle, thank you so much. I had the truly pleasure of serving on the Alliance board for many, many years. It's an incredible board, which we've talked about, and I know, though, what it takes to be a leader of the board, and I just want to make sure we understand Michelle is that leader, replacing Jim Scott, who's in here, but Jim, I will tell you, now have a great replacement, and we're going to hold on to her, so congratulations to our director. So here to present the last award this evening, the 2024 Perennial Heroes Award, is Molly Burek. Molly Burek is the Senior Director of Public Policy at Otsuka Pharmaceuticals, Inc., where she leads the health policy team. Ms. Burek develops strategies to support and execute on Otsuka's policy platform to support all their products. Ms. Burek was formerly the head of public policy at Boehringer Ingelheim and has held previous positions in federal and state government affairs, public policy and reimbursement across other organizations, including Excendia and America Source, Bergen Company, and Avalere Health. So Molly, I turn it to you as the last presenter of such an impressive award. Let's give a big round of applause for Molly.
Thank you so much, Kevin. That was a lot of detail, so I'm going to shorten that. Tonight, it is my distinct honor to present the Perennial Hero Award to someone who has not only been a driving force for positive change, but also a dear friend, partner, and collaborator to the Alliance, Karen Jones. As the president and CEO of the National Caucus and Center on Black Aging, NCBA, Karen has spent years as a fierce advocate for older adults, particularly in communities of color. Under her leadership, NCBA has led the charge on issues such as housing, employment, healthcare, and making sure that underrepresented voices are heard and their needs are prioritized. The NCBA is the only national organization focused on minority aging issues. Under Karen's leadership, NCBA has worked to empower older adults with the information they need to advocate for their own health. The Alliance has worked closely with Karen to help address areas of need for patients across a range of health conditions. NCBA has served as the co-convener for the Champions for Vaccine Education, Equity, and Progress initiative, which has played a key role in our shared efforts to expand access to vaccines and address healthcare disparities. The Alliance, NCBA, and Healthy Women Together lead the coalition, which currently counts over 250 organizations as partners in encouraging all eligible individuals to get vaccinated against infectious respiratory illnesses. She has also been a powerful voice in the Alzheimer's disease community, serving as a prior board member of the Alzheimer's Association and lending her expertise as the FDA evaluates new treatments for the deadly disease. Her advocacy is deeply rooted in her own experience, as Alzheimer's disease has touched her family, and she has used that personal connection as an inspiration and fuel for her tireless efforts. She has also contributed to the efforts to raise awareness around heart valve disease and health equity, with NCBA partnering with the Alliance to host flagship events for Heart Valve Disease Days. Her leadership is not just about policy, it's about changing lives. Also, did you all know that Karen served for 8 years in the Texas legislature? Fun fact. We can clap for that. Tonight we celebrate not only Karen's remarkable achievements, but also the heart, passion, and personal touch she brings to every cause she champions. On a 2022 episode of the Alliance's podcast, This is Growing Old, Karen said, quote, "If you're as blessed as I've been in my life to be able to have family, to have good health, a wonderful career, good friends, and live in a community that you know cares about each other, growing older is really special," end quote. I know that we count ourselves fortunate to have a caring leader like Karen in our community to shine light upon the path. Karen, thank you for everything you do to uplift others and for being a beacon of positive change. On behalf of all of us, it is my honor to present you with this year's Perennial Hero Award.
Well, as the senator said, she stood between us and dinner. I'm between you and getting home, so we'll be very quick. I am very pleased to share this evening tonight with my husband, Eris Allen, and my son, who flew in from Zurich, Switzerland, to be with me tonight. Thank you, Molly. And a special thank you to the Alliance for Aging Research for this recognition. When I first began working specifically in the aging field, which was about 23 years ago, I referred to older adults as them. Now, I am one of them. So I have never really been comfortable in receiving recognition for my job. But working in the aging field has been one of the most rewarding choices that I have made in my professional career. I recognize that any success that I have is a result of all the dedicated people that I get to work with at NCBA, our board of directors, our volunteers, our many, many partners like the Alliance, which are committed to improving the lives of older persons as they age in dignity and with respect. I know that you've heard this quote in many versions by many people, and that is, how a society treats its most vulnerable is always the measure of its humanity. I accept this honor on behalf of all of those, all of you, who devote their work to a society that understands the value of good health, the kindness of others, and the best of the humanity to one another. Thank you again to the Alliance for this recognition, and thank you for all you do to support healthy aging.
Well, thank you, Karen, for all that you do. How about a big round of applause for all the awardees? So we're coming to a close. One of the joys of this is we say we'll land at 9 o'clock. We missed it by a little bit, but I think there's two things we want to talk about. One is I can't tell you, we need to give one more incredible round of applause. Sue Peshin is it. this does not come together easy, but the dinner is nothing what she does each and every day for 360 days. She's passionate, she's dynamic, she's powerful, she believes in each and every one of you. The ego's over there, the goal's up in the front, and so we're so proud to have you, Sue, as the leader of this alliance, and we just want, again, from our bottom of our hearts, to thank you for all that you do. We also got word that this, incredible during this difficult and challenging times we have in the economy, et cetera, this is our best dinner yet. So congratulations for the alliance. And as we close, we say, working together, we understand that the experience of healthy living is not going to be a dream. We're here in this room to make it a reality. So together, let's not stop today. Let's get energized by today. And let's ensure that together we continue to advance healthy aging, equitable access to health care, because the mission is so clear ahead of us. So we want to thank everybody on behalf of the Alliance for Aging Research. Your partnership, your energy, and all that you do has made us a special day and a special evening. We hope you enjoyed it. Now, outside are very much dietetic miniature food. That's very important, as you can tell. But we hope you have a great desserts, network, continue to enjoy the evening. On behalf of the Alliance, many thanks and all the best to all of you. Safe travels home.